We should acknowledge the reality that mistakes in handling such cases have been all too common. Today, we will confront these mistakes head on, seeking to learn from them. So the most common mistake that we come across is denial of treatment. Under Section 357 of CRPC, this section mandates that it is the duty of hospitals to provide medical treatment to survivors promptly and sensitively. This denial of treatment is also punishable under Section 166B of IPC. After denial comes the inadequate treatment. A situation may arise where the doctor has agreed to now treat the patient, but due to our tunnel vision to medico-legally examine the patient, we forget that the patient also requires emergency contraception, access to emergency contraception, STI testing and treatment, psychological support, and information about support services and legal options. When such a survivor comes to us, it is our responsibility that treatment, that first aid should be our primary responsibility. After that comes the medical legal examination. After that, lack of moral sensitivity. In another institute that I have worked in, I have myself witnessed doctors passing jokes and derogatory terms. पहले तो मजे ले लिए, अब हमारा टाइम खराब करने आ गई हो, या पहले शर्म नहीं आ रही थी, अब मेडिकल करवाने में शर्म आ रही है. I have also seen them biased or prejudiced whenever a case, especially of a prostitute, reports with such a crime. They even blame the survivors. तुम्हारी ही गलती होगी, तुमने कपड़े गलत डाले होंगे, तुम गलत लोगों के साथ घूम रही होगी. I have even seen the doctors negatively counseling the victims. नाम खराब हो जाएगा फैमिली का, just to avoid completing the lengthy medico-legal formalities. Even the victim's behavior is sometimes misinterpreted. For example, delay in reporting. तुम इतने दिनों बाद क्यों बता रही हो इस इंसिडेंट्स के बारे में? Then lack of physical injuries. इसे तो कोई एक्सटर्नल इंजरी नहीं है, ये झूठ बोल रही है. Then fragmented memory of event is also questioned. The fragmented memory of a traumatic event, such as sexual assault, can occur due to various psychological as well as physiological factors, including body's natural response to trauma. I have seen the doctors asking, ये बार बार अपना स्टेटमेंट बदल रही है, जरूर झूठ बोल रही होगी. The lack of privacy. The lack of privacy during examination of such a survivor can occur due to various reasons, including limited physical space for examination rooms, insufficient training among medical staff regarding the importance of privacy, the presence of unnecessary observers, including male interns during the examination of sexual assault, can significantly compromise the survivor's privacy and dignity. This situation can exacerbate feelings of vulnerability and distress for the survivor, potentially leading to re-traumatization. Again, please ensure that the only essential personnel directly involved in the examination are present, and prioritize the survivor's comfort, confidentiality, and autonomy throughout the process. As was seen in X versus the Principal Secretary, Health and Family Welfare Department, the court mandated that the identity of minor who comes for MTP cannot be revealed in the information sent to police. What happens is when any minor coming for the MTP you comes to the MTP, it is he or she is constituted as a victim of sexual assault, and police information is sent in a used to be sent in a regular manner. However, in this case, the Honorable Supreme Court mandated that the identity of victim should not be revealed, and a pseudonym should be used until and unless there is explicit consent from the minor or her guardian. Consent is perhaps the most discussed topic, yet the issues of inadequate or invalid consent arise from time to time. Common meaning of consent is permission, whereas the law perceives it as a contract between the patient and the doctor, which is enforceable by the law. Consent should be specific for each procedure in this case. There has to be separate consent for the medical treatment, for the medical legal examination, the sample collection, and if it is a minor, then we have to take consent even for sending the police information, wherein the identity has to be revealed or not revealed. So, the right of the survivor to refuse the examination should also be communicated. It should be in her own language. For example, contents of the above have been explained to me in my own language, which can be Hindi, Punjabi, or English, or any other language. If a special educator has been used or an interpreter has been used, his or her name and signature should also be there. In the end, the signature of survivor and the witness should be there along with the date and time of examination of signing this document. Incomplete examination results from not conducting a thorough physical examination, improper documentation, improper collection of evidence, improper drafting of opinion, and failure to provide referrals or a follow-up care, and ignoring the signs of emotional distress. All this can result in crucial evidence being overlooked. Incomplete examination can result in court making adverse remarks against the doctor. For example, recently, the Karnataka High Court ordered action against the doctor for negligence in medical examination of a POXO survivor. What happened here was that the sexual assault certificate was incomplete. It did not have an opinion whether the sexual act was committed or not committed. So negative opinions are also important in such cases. Then inadequate training and failure to keep abreast with the current changes results in errors in evidence collection and documentation. Ongoing trainings and CMEs are essential to ensure that we are equipped to provide survivor-centered and trauma-informed care. For example, in Nirbhaya case, which happened in 2012, after this Nirbhaya case, a Verma committee was set up under the guidance of Chief Justice of India, Verma. This committee recommended a ban on two-finger test. However, the two-finger test used to be done even then. Then in 2014, the Ministry of Health and Family Welfare, उन्होंने guidelines निकाली, guidelines and protocols in medical legal care for survivors, victims of sexual violence. In that also it was mentioned the size of vaginal introitus has no bearing on a case of sexual violence. It also reiterated that two-finger test should not be done. However, it was still done, and in 2012, in the state of Jharkhand versus Shailendra Kumar Rai, the Supreme Court again reiterated that the two-finger test has no scientific basis. It re-victimizes and re-traumatizes the victim, and for the first time, the court contemplated action against the doctors who will be found doing this test. पर कुछ डॉक्टर्स फिर भी नहीं बदले. Recently in 2022, a court in Kota, the POCSO court of Kota ordered action against the doctor for conducting a two-finger test. More recently, in 2023, the Himachal Pradesh High Court ordered the doctors to pay a compensation of 5 lakhs to the victim for conducting the two-finger test and questioning the virginity of the victim. Overall, such mistakes arise due to lack of communication. The greatest myth is prevalent in hospitals is that communication has taken place. Effective communication by healthcare professionals is crucial in ensuring that survivors of sexual assault receive appropriate medical care, forensic evidence is properly collected, and the legal process is facilitated in a sensitive and respectful manner. Now I call upon Dr. Aanchal Agarwal, Assistant Professor, Department of Obs and Gynae, to speak on examination of such survivor. Thank you.
Good afternoon, everybody. I'm Dr. Aanchal, and thank you, sir, for elaborating about the sensitivity of this cases. On the National Forensic Day, I would like to add that we as gynecologists are extremely afraid of facing such a case on a duty day, because the rest of the cases we are used to. We are thankfully not used to these cases, but these are the cases of most sensitive nature, and we have to take full precautions about the maintenance of privacy of name, about taking a proper consent, and about the proper examination. Now, the point I would like to highlight over here is it is not necessary that a gynecologist will be available to do this test. You might be there on a in a peripheral posting, or you might be going to some other place for some short duration time, and such a case might turn up in front of you. As an RMP, you cannot refuse examination and treatment of such a case. So, if there is no gynecologist available, every RMP can one day face this situation where that person will have to examine such a case and do all the formalities. So kindly pay attention to this part of the CME. Stop. There is something wrong with it. Thank you. Okay. Understood. Fine. So the patient either will be brought by police or the patient might come herself. So if the patient is brought by police, you have to see whether she is consenting for examination or not consenting for examination. If there is consent for examination, that you can simply proceed with the examination. If there is no consent, then we do not proceed with the examination. If the patient has come herself, in that case too, we will check whether the patient is consenting or not. Only if the patient is consenting, then we can proceed with the examination. So again, highlighting the importance of a proper consent. The age of consent for sexual intercourse is 18 years, but the age of consent for physical examination is 12 years. Consent of guardian is required when the age is less than 12 years, or the patient is mentally unsound, or if the patient is unconscious or is under the effect of some drugs. Written informed consent of the victim for physical examination and collection of samples separately, mentioning that findings may go in favor or against her. This point has to be told to the patient right there when the consent is being taken. This has to be signed by the victim, a witness, and a doctor. A witness would be somebody who is uninterested in the case, that is, The witness will not be from the doctor's side or from the patient side. This has to be an impartial witness. Identity of the victim is not revealed. It is a punishable offense under 228A IPC. It has an imprisonment of 2 years and fine. So the preliminary data has to be collected first. That is the date, time and place of examination. It should be a suitable place with proper maintenance of privacy. Name, address and age of the patient has to be documented. 2 identification marks with proper description about the size of the mole and the type of the mole. If the identification mark is a scar, we have to properly tell the size exactly of the scar. Marital status, the last menstrual period, occupation, height and weight. In history taking, the relevant history will have to be taken. That is the menstrual history, any pregnancies in the past, surgeries, venereal diseases, and statements regarding the event have to be asked. Whether she knew the accused, any drug or alcohol prior to or during the act, any threat, restraint or weapon used, did she call for help, date and time of the offense, place of offense, any recent consensual intercourse, number of assailants, if any resistance was offered, which injury she is aware of. Probably she was unconscious for a part of it. So whatever injuries she is aware of. Any pain in walking, micturition, defecation, ejaculation, if anywhere and if any and where, bleeding if any, did she scratch, bite or injure the assailant, relative positions of the victim and accused, the types of sexual acts, number, use of condom, lubricants, using pad or tampon, where it was disposed of, did she lose consciousness, events after the act, has she changed, has she taken a bath, has she brushed her teeth, time between the incident and the police complaint, reason for any delay. General demeanor during narration has also to be mentioned at the time of making your report, whether the patient was aggressive, agitated, angry, calm, cooperative, and tearful, withdrawn, shocked. The vitals have to be mentioned next. Then the gait, intoxication. The physical examination has again to be done after taking a consent, after maintaining privacy of the patient, and in a well-lit room. We have to place a white sheet or a white huge piece of paper, and the victim has to stand over it and undress. Because if there is anything that falls over that sheet, that has to be separately collected, labeled and sent. Clothes have to be examined for any tears, soiling, loss of buttons, stains, foreign material. These have to include handkerchief, tampon, pad, and you have to describe and mark any stain, tear, etc., such as marked over here. All this has to be placed in a paper bag. On physical examination, we have to mention the secondary sexual characters, and dental examination for age has to be prescribed if there is any doubt regarding the age. If the patient is an adult, then probably that would not be needed. Marks of violence such as scratches, bruises, bleeding, bite marks on all these relevant areas have to be checked and mentioned. For scalp hair, we have to comb the scalp hair and collect any loose or foreign hair. Pubic hair also we have to tell about the general condition, whether they are matted, stained, and we have to comb and clip these hair. Fingernails have to be checked for any breaks, scrapings, clippings of all 10 fingers have to be taken. We have to pack all these in separate paper envelopes. Patient has to be placed in lithotomy position. After asking her, then anesthesia may be required if it is very painful for the patient. Visual or corpuscopic examination has to be done of the clitoris, labia, hymen, fossa navicularis, fourchette, vaginal introitus, vaginal canal, vault, cervix, posterior commissure, perineum, back of buttocks and anal canal. As emphasized on by Sir, PV examination is not to be done. Until and unless it is medically indicated, there is strong suspicion of any tears, any injuries inside. Tears, ecchymosis, abrasions, redness and swelling, all these have to be described in detail in any of these sites. Swabs have to be taken, 2 low vaginal swabs, 2 high vaginal swabs, 2 cervical swabs, 2 anal or rectal swabs, 2 oral swabs, 2 bite marks. If there are any bite marks, then 2 swabs from that. If there are any stains, then 2 swabs from them, from each stain. The samples that are preserved are now in toto: clothes, any pads or tampons, loose hair, buttons or other objects, nail clippings, matted pubic hair, swabs, blood has to be drawn for police and for your own lab. For police, we have to take blood sample for DNA, alcohol, etc. And for own lab, we have to take for HIV, hepatitis, and venereal diseases. Urine for police and for own lab, urine again for alcohol and for pregnancy test. All this has to be sealed, labeled, and handed over to the police under receipt. X-rays can be ordered for determination of age. The last page on that is of opinion. A proper opinion has to be given in the terms of whether there was evidence of recent sexual intercourse or any sexual abuse seen, and if there is any positive test about pregnancy or alcohol intake. Final report is always after the test results. This opinion is very important because again we can be penalized by the court for not writing an opinion. Also very, very important that the patient, the victim is also might also be suffering from any traumas due to the event. So we have to give the patient proper follow-up care, and we have to prescribe her drugs that will prevent any pregnancy or venereal disease. We also have to tell her the follow-up visits, how often and what will be the nature of the visits. Probably she has to get some treatment done. Probably there is a pregnancy which she has to get terminated. So we have to describe in detail about the follow-up. Counseling has to be done by a qualified counselor and treatment as required. Thank you so much.
Very good afternoon, esteemed colleagues, seniors, and students. So the part I am covering today is on the drafting of the opinion. Opinion formation in the case of sexual assault is very important. This will be the part which will go in the court and dealt by the police. So we will deal it in the two category. Due to recent guidelines, we form the opinion in two steps. First will be the provisional opinion by seeing the clinical history, as the ma'am told.
They will not trust you. So you start with the open-ended one, and then gradually over time, then you may ask some close-ended questions. What you need to do is active listening, not listening for the sake of listening. And how does the victim know that you are doing active listening? Is by using those two very simple techniques of counseling called parroting and paraphrasing. When I'm talking to a victim of, or any of my clients, the client need to understand that I have understood what he is speaking. So what I do, like a parrot, I say, okay, you said that you were going, let's say this person had a traumatic sexual assault by a friend. So you went to a friend's place, and so just parroting, repeating the same thing what he has said, she has said. Then paraphrasing. Paraphrasing is one step ahead of parroting. You repeat it, but you also give your own interpretation. So these are some of the techniques by which we begin the counseling process. And once we have started the counseling process, what is the evidence-based counseling process or counseling techniques or therapy techniques which are useful in people encountering traumatic sexual abuse or sexual assault? The most important one and the most widely used one is called as cognitive behavior therapy. People go through traumatic sexual assault or abuse, but the long-term consequence is not due to the abuse or assault itself. It's because of the meaning of the abuse or assault in their mind. So many people have this maladaptive thoughts that if somebody has assaulted me, abused me sexually, means I'm impure. It could be a maladaptive thought. Means I'm not good for anyone else now. This could be a maladaptive thought. So changing that maladaptive thought is the is the basic premise of cognitive behavior therapy. For example, you see in this, here are some of the typical maladaptive thoughts that people have. Like somebody who's had sexual assault, taking it personally. So this is all my fault. It's very classic. Many times they will start blaming. Or magnification, that this means, as I said, that this means now onwards my life holds no meaning. So magnifying that traumatic experience, putting that blame on themselves, these are some of the maladaptive thoughts, and we need to change that maladaptive thought. That is what we do during cognitive behavior therapy. One very good therapy technique that is highly useful in people of sexual abuse going through PTSD is what is called as EMDR, eye movement desensitization and reprocessing. So what we do is that we ask the victim to recount the experience, and while they are recounting the experience, we ask them to fix their gaze on, let's say, a pendulum or let's say our finger, and we ask them to keep moving, keep following our finger or that pendulum or whatever that it is, a probe, and while they are following that moving pendulum, we ask them to recount that experience. It is known that when you are recounting that experience during that eye movement desensitization, you are able to recall it and then you are able to reprocess it. So if you have a maladaptive belief regarding that traumatic experience, you are able to reprocess. So it's a very guided method of counseling that we can do, and it is useful. Then third very useful technique for counseling for these victims are what is called as narrative therapy. In their mind, it is so jumbled up. Every time you ask them to recount, they will have a different memory of the traumatic experience. So the narrative therapy says that we ask them to recount, and while they are recounting, we change their belief system, their belief regarding that experience. So that again is something like EMDR also, but here there is nothing like they have to process, they have to follow any moving object. Then the fourth is mindfulness-based therapy. All mindfulness-based therapy basically says, see, the traumatic experience was in past. So all mindfulness-based therapy techniques say that you have to be in the present. So relaxation techniques and trying to be in the present, what has happened in the past, moving on from that. So that one more technique for counseling of such traumatic victim. What was earlier considered as a gold standard is not recommended anymore, is called as psychological debriefing. So debriefing, where we allow the victim to ventilate, allow the victim to catharsis, like going through the catharsis. Now it is considered not useful to prevent PTSD in future. So it is not very well recommended nowadays. Sometimes they may require some psychiatric treatment also apart from counseling. Like they may require some medications if they develop some of the psychiatric disorders like panic disorders, etc. to prevent suicidal ideas, to prevent depression. So this we can move on. And once we have done the acute counseling, that is not the end of it. So long-term treatment is needed, and that is individualized based on each of the victims and their how do they eventually process the traumatic experience. So sometimes CBT is needed, sometimes DBT, that is dialectical behavioral therapy is needed, sometimes EMDR is needed, I've already spoken about it, expressive therapy, and sometimes psychopharmacology also. Just two simple cases. We all see, I'm not going to go into detail of the cases, but an adult going through a sexual abuse or assault and a child going through a sexual abuse and assault, your techniques that you are going to use are going to be different. So each case, as I just said, is different. We need to be very empathetic. We need to show that we care, and through these counseling techniques, we are able to help them navigate their traumatic memory. So thank you very much. Now I'll call Dr. Harvinder for the concluding remark.
So such a patient does not come to the hospital only for medical examination. She also comes for treatment of injuries and treatment of psychological trauma. The Criminal Law Amendment Act 2013 mandates that all hospitals, public or private, to immediately provide first aid or medical treatment, and that too free of cost, to victims of acid attacks or sexual violence. Such ये किया जा सकता है वन स्टॉप क्राइसिस सेंटर्स में. We do not have one stop crisis center at present. One stop crisis center is a private area where the individual will be taken, she will be treated there, she will be medically examined there, she will be provided legal opinion, even the police will report there, even social support is provided there. The approval and funding for one-stop crisis centers is provided by the Ministry of Finance, Government of India, which has established the Nirbhaya Fund for Women's Safety. This location is selected as per the recommendations by the Justice Usha Mehra Commission. These can be in both public as well as private places, private hospitals. Such one-stop crisis center can also be established in our institute under the Department of Forensic Medicine and Toxicology. Let's confront our shortcomings and critically examine our practices. We should strive for excellence. As ma'am said, सबको कभी ना कभी ऐसा केस मिलेगा. If you feel that you are in a tight spot, you need help, you can approach us, the Department of Forensic Medicine at Himalayan Institute. By acknowledging the mistakes of the past, we can better equip ourselves to navigate the complexities of these cases with empathy, professionalism, and forensic vigor. Thank you. Now the session is open for questions. Any questions from the audience? So this session.
Thank you, all the speakers, all the excellent speakers.
So just as an experience, we were posted in TV hospital from here, and there we used to have POSCO cases, and the samples were drawn in front of us. We used to be there as pathologists in front of a medical officer and a police officer and all. So just to share an experience, after that we had to pathologists are usually at our institute are not used to giving court evidences, but there it was there, and the form was so diligently filled with all the right hand mark and etc. etc. And the judge, because I had an encounter, the judge asked who all were present there, when the mother was present. They used to take samples for DNA. Both the accused and accused, दोनों के samples होते थे. And that was an experience for us also. And उसके पहले we didn't realize. And we had witnessed that, we didn't examine, but only taking sample, the victim there sitting was like a very different experience for us. So of course the gynecologist and anyone who goes as a medical officer to examine the patient definitely should be trained maybe, because it is very difficult to, I think, do anything at first go.
In periphery, anesthetists, surgeons, orthopedicians, everyone does the examination of such victims, and they are not trained properly. Due to which, what they do is they try to hush away the victim ki pehle jao, police pe jao, pehle FIR leke aao, which is against the law. FIR is not needed in such cases, but they try to make the patient go away, which re-traumatizes the victim. Re-victimizes her.
But they want to buy time.
They want कि उनकी
So that their duty is over.
ड्यूटी हाँ जी उनकी ड्यूटी ओवर हो जाए और दूसरा आके फंस जाए.
I would also like to add that in such cases, there are two aspects. One case is examining the patient and preparing all those formats. Another aspect is going to court and standing in front of the judge and explaining everything that you have done. And for that, especially, we need training. We need some kind of a session or a training to do that, because when a person goes for the first time, that person is totally clueless regarding where to go in the court, who to contact, who to talk to, what is the way you have to present whatever your findings were. सब कुछ हिंदी में होता है, proper terms में होता है. So all that, I remember when I went for my first and second case, I cried on my way back. And now because I've gone in some 7-8 cases, unfortunately, now I am better equipped with the information, how to go, what to do about it. But especially when you go initially, you feel very, very upset after presenting that case. So there should be some training. I would request the forensic department to.
Ma'am, through your experience, we can make a question bank of most commonly asked questions in such cases.
Yes, sir.
Then which will help the other.
And the lawyers, the government lawyers on your side, but the other party, they are so harassing. They totally make it a very, very hostile environment in court itself. Thank you.
But they try to intimidate.
Yes.
Also they asked कि आपने सैंपल किसको दिया? आपने अपने हाथ से दिया?
Those are just intimidation
And
tactics.
in a board case, the advocate asked me, out of you three, who sealed the samples? I told him, एक ने रस्सी बांधी, एक ने लात लगाई, और एक ने पकड़ के रखा. So they will try to intimidate you. You have to intimidate them.
So, first of all, I'd like to congratulate Department of Forensic Medicine for coming up with such a subject or topic which is socially very relevant, and we all need to be well equipped with dealing with such cases. So, rightly said by, I forgot, Aanchal, Dr. Aanchal, that it is very harassing, specifically when lawyers ask you such questions in court because they are just trying to prove you wrong and tell you that you were incapable of coming to any conclusion because of your expertise, opinion, or whatever it is. So, and thank you for rest, Psychiatry Department, Dr. Priyaranjan Avinash sir, and Gynae Department for briefing us up into this. Thank you.
और मैम कोर्ट में वो डराते तभी हैं जब उन्हें पता होता है कि आप सही आंसर कर रहे हो. When you are wrong, they are very happy. They do not answer you anything else. और जब आप चले जाएंगे during the discussion with the judge, then they will point your mistakes. Sir is saying always go with the confidence that you know more than everybody else.
One more question. If we refuse examinations, what do you do next?
I mean, if the victim refuses examination, we cannot examine.
The accused, because at times both are brought to you.
If both can refuse, both have right to refuse examination. Even if court orders examination, even then consent has to be taken. And if she refuses, informed refusal has to be taken. No court or police can कि वो force नहीं कर सकते examination. Again, that will be re-victimizing the patient.
But actually, if the victim refused to for the examination, for the medical legal purpose, but she wants that she should be treated.
Treatment cannot be treatment तो करना ही पड़ेगा.
But when you give the treatment, then still you need to make some record or some reports.
Yes, sir.
And then again they can be used for the evidence as in the court.
Yes, sir.
So how it will make any difference whether she is giving any consent or not giving any consent when you are writing each and everything?
So consent has to be taken for sample collection also.
No,
During
you are not
treatment.
taking the sample, that's fine. But if you examine and write down that there is a tear, this is this and this and that,
So
and that file can be used in the court of the law.
So she is victimized. She is traumatized at that time. She may refuse earlier.
Yes.
She may then after.
My point is that even if she refused, but she is liable to get treatment. Number one, she should get the treatment. And if during the course of the treatment, whatever you are writing, ultimately that has to be taken in such a way that might be after some time the patient mind will change and she said, yes, I came to you and you had examined me and you had treated me, now I want to do any case.
So that is the importance of consent. Because if we have taken a detailed consent for everything, positive or negative, at least nobody can question why we did not conduct that examination. And the kind of examination that we do for treatment purposes and the kind of examination that we are doing for this case will be slightly different, because when we take examination for the purpose of like taking all the samples, in taking all the samples is very detailed. Every part of the body is being examined.
Except the sample.
Yes.
Rest all the physical mark, this and that.
Definitely, sir. All
that
the
you have to
injuries,
mention in your
all the
case sheet.
injuries will be mentioned in our case sheet. All the we'll have to treat for every injury. So all the injuries will have to be definitely mentioned. And already it will be, because we will have to make a police information will have to be sent from our side. If there is any suspicious case, in that case, even if the patient is saying that no, I don't want any examination, we will have to send for a police information. Then police will get into the matter whether the patient wants to get an FIR done or not. That is still in her hands. But we, as clinicians, we have a responsibility to inform police by sending a document over there.
So this can happen in any case, even in cases of physical assaults. So if the patient refuses medical legal examination, we still note down the injuries.
Yes.
We still note down the injuries, and only when he consents do we prepare the medical legal report. If he goes to the court, then court asks us to prepare the medical legal report. Then we note down that the injuries are being reproduced from the treatment file.
So I like to consulate to the forensic department, to sir and all of you. But one thing I like to suggest that definitely there is a lacking in our postgraduate program, particularly gynae. I don't know whether you are giving this type of training that what they should write down and what not. Secondly, I used to go so many times for these cases, for accidental cases. Definitely whatever your experience is, we had faced the same. Now a little bit easier that now we can do a virtual so that we are not going to the court.
Yes, sir.
But otherwise, it is my suggestion that at the level of the postgraduate level or the PG student, there must be something from the forensic medicine side that one or other day they will come into this, and then how to face these challenges at the court.
Maybe a mock drill or something can be prepared with a patient, victim.
One question. If patient present to you later on, suppose weeks or months after, for treatment of injuries, whether it is genital or physical injuries, and till then patient is taking the treatment from coax or something or self-treatment. What is the plan of that point?
So we have cases where the patient has presented to the hospital even after 2 years, or he or she has been sent by the court for examination after such a lag of time. So even then we examine the patient, and whatever the findings we note them down. Scars may be there, we note them down. The sample collection is lacking here in these cases. Then it is up to the court. So is it clear?
So any more questions? Okay. So thank you forensic department and all other the obs and gynae and psychiatry department for the excellent talk. And indeed it was an enlightening talk, and our undergraduate students are also there. So thank you for sensitizing them also. Thank you, sir. Thank you.